I'd like to talk a little bit about working differently in primary care that's resulted from the COVID-19 pandemic. And I think working differently has applied across health and care in North Cumbria, but particularly in general practice, I've seen some big changes that some have been very, very positive and those that we would like to still to continue with and embed really into the future. So I think the first change is that in such a crisis situation, the people that are within that have been very resourceful and worked together to try and solve some of the immediate issues that we faced really, whether it be around PPE, how we actually dealt with patients needing to see a doctor, and basically how we supported all of our teams and our patients. So I think the first thing that I will perhaps talk about is the increased use of technology. And I think everybody would say that we've had to use technology in a way that we've not particularly embraced in primary care before. So remote consultations have become much more common, and certainly for the practices within NCPC, they hadn't probably used remote consulting as much as it could have been used. So again, we had to really get people up to speed with the use of the technology, actually get the equipment in place, and also educate some of our patients on how we could ensure that they had a reasonable consultation, albeit via phone or it could be by a video link. So those sorts of things I think are very positive and have their place, although they'll never ever completely replace the face-to-face consultations that I think are necessary in general practice. They're certainly complementary, and I would want to embed those and keep going with them. The other thing is that our staff worked so closely together to solve problems in a way that was delightful to see really. I think there was that whole team working, how to solve problems, how to still meet the needs of patients yet worry about things such as PPE and safety. And that working together has created a bit of a culture really of problem solving that I don't think was perhaps as prevalent before. And I'd like to again encourage staff to and support staff to look at how we do things differently, what improvements can be made. And I think COVID has accelerated ideas that people had that actually we thought, right, let's just try them. And that's an area of learning that trying things often gives us lots of perhaps unexpected improvements, and improvements that could be sustained past the crisis point. So I think the resilience of staff has also been very much a change, that we've all had to build up a resilience and understand how to manage on a day-to-day basis with often difficult situations. So I think that the change that's occurred has been broadly positive, but we also need to recognise that that was in the response to a crisis situation. So there's a sense of now, let's evaluate what we can embed, let's learn from it, and let's take forward the good bits that we know that have come out of this terrible situation. I think the benefits for patient care are that we did manage to keep some continuity and offer patients some of what they needed during that time, and we know that proved difficult to be able to do that safely. I think other things that will benefit patient care into the future are the continued use of technology where it's appropriate. And often that means that we don't need to bring patients down to the practice, that some things can be dealt with on the phone. We've also got a lot better at triaging patients and listening And the listening bit's really important, because triage to me, when you can't see a patient, it's really important we listen to all the clues about what perhaps a patient's worried about or the symptoms they have. So I think that there's some real positives there, and we've had some good feedback about people saying, well, it's been really good because I've been able to access a GP opinion much more quickly over the phone than I would have done if I'd waited for an appointment. Now, of course, there's a trade-off there, that we have to look at those patients that we really do need to see in practice. So I think some of the benefits are that there's different models that we can look at that suit different situations for patients. And the problem we all have with access, we could use technology more to support that.